Today we're here with one of the world-leading experts in the newly named polyendocrine metabolic ovarian syndrome, Professor Aled Rees. Professor Rees, can you tell us a little bit about the condition? So what is PMOS?
So PMOS, or polyendocrine metabolic ovarian syndrome, is the commonest endocrine or hormonal condition in young women, affecting 1 in 8 of the population. So that's about 170 million people globally.
Is it true up to 70% of patients are either have the condition but don't know about it or have a delay in diagnosis as well?
Yeah, absolutely. So it is a common thread amongst patients that there's been a delay in diagnosis and frustration a little bit about that delay or the experience around sort of diagnosis. So we're hoping that the name change will improve that.
What's the root cause?
So if we think about the clinical features, classic what we rely on when we take a history from a patient with suspected PMOS is to get an understanding of their menstrual cycle. So menstrual irregularity is present in the majority, but not everybody, so irregular or absent periods. And another classical clinical feature is what we call hyperandrogenism. What we mean by that is things like unwanted hair growth, scalp hair loss, severe acne. Those would be the features there. So when it comes to pathogenesis, what's actually causing it, there is a genetic component, but we also know that, for example, weight gain can unmask some of the features. And there are two major sort of underlying causes, if you like. So insulin not working as effectively as it could do in the body, and elevated testosterone or testosterone-related substances.
Okay, excellent, and thank you for that explanation. With the name change, first of all, why is that important? And second of all, what do you think the clinical impact worldwide would be from this?
So I think the problem with the old name that we heard from people living with PCOS, as it was called beforehand, or polycystic ovary syndrome, is that it put all the emphasis on a single organ, i.e. the ovary, and therefore it made people focus very exclusively on this being a reproductive condition. And it can have some reproductive manifestations, but we know from a lot of the research that's been undertaken around the world that this is a multi-system disorder affecting a lot of different body areas. It's also a chronic lifelong disorder rather than just being focused at a certain stage in life. So that was one of the problems with the old name. It also was medically inaccurate, so there isn't an evidence of increased cysts in the ovaries in this condition. It's not actually cysts that develop, it's what we call follicles that are there. So people were being misled by the old name, and what we hope with PMOS, the new name, is that it's more scientifically accurate. It puts the emphasis on the underlying cause, which is in relation to hormonal disturbance, puts an emphasis also on metabolic, which reflects the increased risk of, for example, diabetes and cardiovascular disease that some people with PMOS are at increased risk of. So that's really been the shift here.
Amazing. Okay, no, I think anything that can improve patients' access to healthcare and an improved or earlier diagnosis is a welcome sort of change. Is there anything else in the world of endocrinology, in which you're an expert and professor, that you think could also do with a name change?
There have already been some examples where that's happened. So one of the conditions that we deal with as endocrinologists is disruption of the pituitary gland, which is often seen as the master gland in the brain and controls all the hormones. If people have problems with one of the hormones related to that, what we call AVP or arginine vasopressin, which controls water balance, it can give problems with a condition that used to be known as diabetes insipidus. And there was a name change for that because there was confusion among healthcare professionals and patients that led them to mistakenly being thought that this was standard diabetes or diabetes mellitus, for which the treatments are very, very different, and that was potentially a dangerous thing. So that name was changed to a more accurate scientific one called AVP deficiency.
Interesting. I mean, as a neurosurgeon, that's something I see with SIADH, and you can even get, after the pituitary resections, you can have dysfunction and lack of ADH. For us, in the literature, it hasn't quite made it there. We still, in a lot of the research publications, textbooks that I've read, it's still called diabetes insipidus.
Mentioning specifically around the name change again for PMOS, this isn't going to happen overnight. This is a 3-year process of evolution rather than revolution, where education, increased awareness, adoption of the new terminology into the medical literature, all will happen during that time frame, culminating with the 2028 international guideline for PMOS, where it will be finally adopted. And that work has been led the name change generally and the international guidelines by colleagues in Australia, Professor Helena Teed and her colleagues.
That's amazing. No, thank you. A big issue is delay in diagnosis. Is there anything apart from this, so obviously we've done the name change, that could be done that could help healthcare providers improve the diagnosis and make it quicker?
There are a lot of educational resources that are being developed and are in existence, for example, both internationally and also in the UK. We work very closely with Verity, who are the main charity partners in this space, and they offer an educational training program every year on PCOS as was, or PMOS as it is now called PMOS time. So that's an example. There are guidelines being contextualized for the UK at the moment that will help healthcare practitioners, and a variety of other initiatives that I think are also important. For example, from the individual's perspective, I think there's some policy shifts that we can think about in terms of education in schools, for example, around menstrual health, and certainly in terms of undergraduate medical curriculums, where we don't just focus on conditions, but we think about it from a symptom-directed perspective.
Thank you so much for your time. Really appreciate it. And if anyone has any questions, please feel free to let us know in the comments. Thank you so much.
Thank you very much.